As you'll know, non-small cell lung cancer remains by far the leading cause of cancer deaths, both in the US and worldwide. This study represents a true milestone for the field because now, for the first time, we can say that non-small cell lung cancer patients receiving first-line therapy, the vast majority can receive immunotherapy with pembrolizumab instead of chemotherapy. And receive substantial benefit. Prior to this time, the KEYNOTE-24 study had shown about a third to a quarter of patients with high PD-1 levels received substantial benefit, both in terms of survival and progression-free survival with pembrolizumab as compared to chemotherapy. This now more than doubles that population that can start with immunotherapy as a first-line treatment, assuming the FDA modifies the label in accordance with the study. I really view this as a double win for patients. Often advances in survival for our lung cancer patients come at the cost of significant toxicities. Here, by contrast, not only are patients living longer and have a much higher likelihood of prolonged survival in years, often instead of months, but they're also receiving a treatment that has substantially less toxicity across virtually all measures. And I'm going to tell you this really impacts the day-to-day life of these patients. Typically, with chemotherapy, patients, when they come in, are dealing with a host of side effects, including myelosuppression or suppressed immune system, nausea, hair loss, numbness and tingling in their fingers and toes. This treatment is really dramatically better tolerated than any of those. And while there are toxicities, they're typically easily managed and reversible upon stopping the drug. So if you take this study and couple it with earlier studies like KEYNOTE-24 and the earlier CheckMate 227 study, we're now leaving an era where the only choice for non-small cell lung cancer patients is to start with chemotherapy, because now we can say that the vast majority of patients can potentially receive benefit from immunotherapy instead of chemotherapy. Now, there are still important unanswered questions, of course, but there's a host of studies addressing these. For example, are there some patients for whom immunotherapy with chemotherapy is superior to immunotherapy? Are combinations of immunotherapy going to be superior to a single agent? How do we integrate targeted agents? And how do we deal with tumors once they've progressed after PD-1 monotherapy? But those will be addressed in time. For right now, I think this represents an important milestone because an era in which chemotherapy was the only option for non-small cell lung cancer patients is drawing to a close. Now, virtually all non-small cell lung cancer patients can receive a non-chemotherapy regimen, either with immunotherapy or, if they have a driver mutation, with an appropriate targeted agent. So immunotherapy is here to stay for the vast majority of non-small cell lung cancer patients as first-line treatment, and this represents a real important advance for patients.
Thank you, John. It really is quite remarkable. I think if any of you were at yesterday's opening session and heard Dr. Johnson's presidential address, you noticed that he showed a slide from an ECOG study that was presented at the plenary session, I think it was 2002, which was comparing 4 different chemotherapy doublets, as they were known, in the treatment of patients with advanced non-small cell lung cancer. And the big news at the meeting was that the outcomes were equally bad with all 4 doublets, and some were less toxic than others. And that made the plenary session, and that was a paper published in the New England Journal, and it was thought to be a study that provided great insight into lung cancer treatment. So now here we are, nearly 2 decades later, but the landscape is so completely different. It's quite remarkable. We're now talking about a time when we're not even going to use chemotherapy in treating non-small cell lung cancer. So quite a remarkable paradigm shift.